Hello and welcome back to the SBDN podcast. We are back, we're returning for winter, and I'm super excited today that I have three guests that have come along today to speak for us, and they're actually three trainee dental nurses. So I'm super excited to talk to them just to tell us about what their journey's been like so far, what's involved, how they're enjoying it, where they want to take their career, just to maybe aspire any others that are out there that may be wanting to take on this journey too. So I'm going to let them introduce themselves. So ladies, if you could just tell us your name and where you're studying, would be lovely.
I'm Ailsa. I study here at the University of Portsmouth as a level 4 dental nurse.
I'm Asha, and I'm also studying here at the University of Portsmouth, and I'm also a level 4 dental nurse.
Hi, I'm Abbie, and I'm also a level 4 dental nurse here at Portsmouth.
Oh, well, thank you, all of you. I'm really excited to hear about your journey so far. It's been a long time since mine, so it'll be nice to hear how things have changed in training and how that benefits dental nurses now. So, what got you into wanting to go into dental nursing?
Oh, I'll go first. Okay, basically, I had quite a rough dental journey. So when I was younger, I fell off a seesaw, and I had to have a lot of reconstructive work done a few years ago.
Ooh.
And the team that made it possible to bring back my smile from what it was just inspired me. And I've always loved the dentist because I've had the same dentist my whole life. So I feel like when the good relationship I had with him and the whole effort that it went to bring my smile back, I want to replicate that and then maybe give that experience forward to other people. Yeah. That's what personally inspired me.
So you were really inspired by the whole experience, which is great.
Yeah.
That's amazing.
Yeah, for me, it was a case of going into sixth form and still not being too sure about what I want to do at university. And I guess that kind of built a bit of pressure because people were already deciding what they want to do, what they want to apply for. And then I found out about the course of dental nursing. I visited a few unis and Portsmouth was my favourite. So I applied here. I really like just the way you get to work with hygiene and therapy students and even dentists. I'm really enjoying the clinical aspect, also the theory. We learn about the muscles, bones of the face and science informing practice, and also the ethical side of dental nursing too here.
It's a lot, isn't it?
I find it really interesting, so I'm really glad that I came onto this course.
For me, I also struggled during sixth form just with deciding what I wanted to do, and I ended up going to a local hospital where I'm from, in Newcastle, the Royal Victoria Infirmary, I think, and they had an open day there where they had a lot of apprentice dental nurses, and they really inspired me. They talked a lot about what they have to do, and I was really intrigued by everything. So that kind of cemented my interest in dentistry. And then I started researching and going to more open days and seeing about dental therapy and hygiene and just all of the history that comes with how far dentistry has come. It really interested me.
I just love that you're all kind of inspired by the journey that other people have had compared to what it used to be. Everyone was scared of the dentist, and I remember saying when I was going into dental nursing, they're like, well, what would you want to do that for? So it's so lovely to hear that you've been inspired by other nurses and your whole journeys. It's amazing. Yeah. So what does your training look like? How do you train now? Could you tell us a bit about that?
So basically we have a different range of methods. So we get taught online, we get taught in person, and we get taught in clinic. For me personally, clinic sessions are my favorite because it's the most hands-on. And the clinic that they have here in the university, in the academy, it's so good. It's literally real world experience, and you get to be very hands-on. I know that's Ash's favourite as well. I think it's pretty much all our favourites. Yeah. So I'll let them go into a bit more detail. The lectures are really good as well. And I feel like a lot of us learn a lot better in person as well. So to have like the one-on-one experience with Beth and Jane and our tutors and Sue, they just explain everything really well. And even though like the pictures that they use and the terminology, even though what they're teaching is quite hard, it's come very naturally. Like all of us, I think the way they've been teaching it is very well. Yeah. If you want to elaborate on that.
Yeah, definitely. So we have clinic once or even twice a week. So this week it's been twice for us. And yeah, like Abbie said, it's really hands-on. It's really good practice as well, because we get put into different bays, either on East or West Clinic here, and we get to work with new students too, every week. And even if you come across working with a student you've worked with before, it's really nice because you're kind of building that relationship too, while keeping it professional with the patients. And then we tend to have usually 4 days a week where we have lectures, whether that's online or in person. Yes, not usually 5 times a week. And I think the timetable's really well spread out for everyone, because some people who commute, they might not be able to attend in-person lectures, so when we have online, it's like quite good and quite flexible for everyone. I mean, the lecturers are brilliant, like everyone explains everything really well. If we have any questions, like the whole class is comfortable to ask, even each other, and then the teachers too. I think, like Abbie said, it is getting quite tricky. For example, science informing practice. However, again, like Makti's great, we ask questions if we need to, and the presentations, the resources are always available on Moodle, which is a website that the uni uses to access PowerPoints and videos and stuff. So yeah, I really like the way that the uni does it here.
Just to add on from that as well, I think clinic's really good because we get to actually like do what we've just been taught, like especially
put it into action.
Yeah, exactly. We have clinical lectures where we learn our clinical skills, and like what our role is as a dental nurse, like mixing alginate, for example, today in clinic, and the reason I knew how to was from that clinical session. So it's just good to learn it first before being in clinic, and then actually like tapping back into that knowledge that you've learned about maybe a week or 2 ago and actually doing it.
On to that, even if, let's say, you're put with the dentist and you're doing something new, for example, for me today, I had it the other way around. I was doing endo, so that's a root canal, with my dentist all morning, and we haven't learned about that yet in theory, but we're going to learn it next week. So it's also good to ask questions because everyone's so like nice about it to help you understand the process of everything and what instruments and equipment is used for what. So even if it's you doing it in practical first rather than in theory, it's still a learning process, and I think it's just all molded really well together.
It sounds like such a lovely way to learn because you get to be in practice, but then you've got the tutors there kind of outside of that you can fire all those questions to, like nurses that are literally learning on the job. That's a lot more difficult because you're paddling for dear life, but it's great that you've got that support. You can ask questions, you can feedback on what you've done that day, and like you're going to be doing a root canal treatment, which for a new dental nurse, that's oh my goodness, because there's just so much. But the fact that you seem quite calm about it, but because you know that you're going to be getting that backup, that your questions answered, so that worry is taken away from you. That's fab.
The lecturers here, like the bond that we have with them is so personal and nice because like Maddie, he's very like, I love his style of teaching. Like he's very out forward, and I love the fact that each lecturer has their different approach to teaching. It's very unique with every one of them, and I feel like with every single one of them they've built a student teacher relationship between us. And when they are on clinic with us, because they obviously grade and mark us and look at what we're doing, the fact that they're then there to then help us improve and give us tips and pointers, and then also point this out in lessons as well, like said, and Ailsa with the balance, kind of how you elaborated, where it's nice to have them there. It's just they're just so nice. It's amazing. Yeah.
I want to join. This sounds great. There's a lot to be said for a really good teacher mentor, though, isn't it? Even when you're at school, you always remember those teachers that helped you remember or help you retain the information just because of the way they teach. So there's a lot to be said for that too. So the more theory side, how are you girls finding that as well as the practical? I know it's not our favourite because we're hands-on, aren't we? That's why we do dental nursing. How are you finding that?
Okay, basically I feel so for me I learn a lot more practical based, but I do struggle slightly more with the lecturers and stuff, but because I work on my iPad, a lot of us work on our iPads or our laptops, and I feel like when we have access to the slides, like Asha said, I can go back and reconvene outside of lesson and reannotate, make flashcards. I feel like online flashcards is the way I'm going to be revising for a lot of our stuff, because for me, I feel like when I can sit there and annotate onto the actual slide, and the fact that I have then access to that for so long afterwards as well, I feel like is amazing, because I can come back and just refresh that at any time, and I can have it on my iPad with the notes I've made from the lecture as well. And the lecturers make it good.
Yeah.
The PowerPoint's good on its own, don't get me wrong, but the lectures are what makes it engaging.
Bring it to life, yeah.
Yeah, I mean, I agree with all of that. For example, we also have pre-recorded lectures for some of the theory, so if someone's feeling a little bit unconfident, we can always prepare before our lecture when we look at our timetable and everything. And also, I feel like all the information we're given, it's almost like more than you think you need, but it makes you feel so prepared and more confident when you do go on clinic. We also have little quizzes that we can access, and I think that's really helpful because a lot of us like to consolidate and then test our knowledge, so it's good that that's also accessible to us in our free time.
Brilliant.
The actual lesson side of it and the actual learning part, as I said before, I really enjoyed the history and everything, and it's actually really nice to learn about the history of what dentistry used to be and how far we've come and what is continuing to change, and a lot of the products that we use in dentistry, they have a lot of other things that you have to consider. We learn about fluoride, topical fluoride, for example. It contains alcohol, so obviously if you have a patient that is Muslim, you'd have to consider that, or a pregnant woman, for example, it could affect pregnancy. So
Absolutely.
It's good to learn that in lesson as well, so then if you ever are out on practice, then you could know that and use that.
It's so much more than just teeth. I don't think people really appreciate our role now. It's huge. The knowledge that we need to know, that for patients, it's a lot, isn't it? How do you find coping with that? What are your kind of stress releases? Do you do anything just to, because I know it's intense, I know some girls at our practice are going through it at the moment, and it can be intense, and you kind of want to make sure that it's okay that just have a break here, or just to forget about it just a day. How do you girls do that?
For me, I love that every patient is unique, and when we get someone who maybe is afraid of the dentist, or has hesitation to work alongside us or with us or come to the dentist, I feel like it can be stressful, but I love that difference. It's not the same every day. A lot of people say, oh, how do you sit and do the same thing day after day? But every patient makes it a different and new experience, which makes it exciting. Just go have a swim. I feel like it's very relaxing. That's how I personally do it. Or music works for me as well.
Oh, definitely. I think all of us music
We're very
is
music
sort
dependent. Yeah.
Definitely.
Yeah.
Yeah, I'd say similar to Abbie. I mean, I like going to the gym, and even I was gonna say maybe having a run to the sunset, but rather a walk, I think.
That's me. I would run to the all over it.
Like, for example, today the weather is so nice, the sky's nice and blue, so I'm guessing it'll be a pretty sunset. And I feel like taking a walk, like, it's so good for you physically, but also mentally, because you get to kind of detach from reality, I guess.
And it's free.
If you want to think about what you did today and like reflect upon that. We actually had a lecture recently about reflection with Sue, and I found that really inspiring, just to make sure to still prioritize your health,
So important.
and physical, definitely, because that does impact your performance, like in your career and at school, for example. So that's what I choose to do, definitely.
For me, I really like how our course is so small. It's a very like tight-knit course. So there's 39 dental nurses, and since it's such a hands-on course, we all like get to know each other quite well. So it's quite good to cope like with the support of them. Like, we all can like lean back on each other and talk and hang out and everything. So I really like that I have been able to make so many friends that understand what's going on. And just to be able to be there.
And you all understand each other's stresses, so it's nice that you've got that little community where you all understand, and if one of you are down that day, there's somebody around that can pull you back up. Whereas I think sometimes the nurses that are nursing on apprenticeship, they're just dipping in online to a college course, they don't always get that, because like the daily running, you just have to make time to pull them aside and to check in, and it's not always as easy. Then they may not feel like they can talk to you, but this sounds like you've got friends for life.
Definitely.
Which is
the three of us
lovely.
became close so quickly. Like, I remember it was one of the first weeks, and after a couple of conversations, we just knew like we'll stick quite close, which is so nice.
I don't even remember like actually becoming friends, like, because for me like it literally like bam,
just naturally
like,
grew.
Literally like join uni, bam, Ailsa and Abbie in my life. Like, we call ourselves triple A because we're all
yes, you're all A. I thought you could only join if your name began with an A.
Imagine.
No, literally, I feel like and the fact that like our course is, I feel like I personally love the fact that it's primarily female for me, because I feel like there's just that companion that like we all have that natural click, and there's 3 guys on our course as well, and dare I say, they click on too, like they like literally it's just so friendly. It's like we're one big family, like that's how I would describe it. Like, we're just like one big family, and it's like I haven't really spoken to the guys on our course. I have spoken to them a few times, but it's like I know that if I needed anything, they would be there, and like same for any of the girls as well. Like, it's just such a friendly environment. Not even on the dental nurses, like hygiene therapists. It's like you just walk into the changing room,
just
or like
cohort, like all together, like everyone's.
You can talk to anyone.
They say there's no hierarchy, and you actually feel that, like everyone's.
And that's important, isn't it? I think nowadays, like, because we do, and you will have your own registration. Like, no one is any better than anybody else. That you're never just a dental nurse, like it is the quote from hell. No one is any better than anyone. We're all there, we're all singing from the same hymn sheet, and we've all got our roles to help that patient, and without us or the dentist, then it all crumbles. So everyone is, as you said, is just as important as anybody else. So I love that that's being pushed for you now as well. What's your favourite part of it so far, do you think? What like treatments, or what is it you're thinking when you see it on a list? You're like, yes.
You go. She's like buzzing.
Yeah, we've definitely said like definitely the clinical aspect. I mean, we were all quite nervous, just like everyone else, about working with patients, because I mean it's real.
Yeah.
But everyone makes you feel so welcomed in the cohort. And once you get the hang of things, you obviously do it weekly, so you get used to it. And you just kind of get into this pattern. Such a friendly staff nurse, able to absolutely to ask questions. And I've definitely learnt quite a lot as well. I've done my part that I'm confident at, but also tried things and stepped out my comfort zone. So I just think it's such a good learning process, and I mean that's why we're in the course in the dental field, because that's what we like to do.
Yeah.
I'd say the same. I have been quite nervous on clinics so far, just because it's only been like a few times, you know.
Yeah.
That confidence is going to build up.
Yeah, absolutely.
I'm finally feeling more comfortable, like doing my part and like putting myself out there, like to talk to the patient. And obviously it just is daunting in itself, because it is such like an uncontrolled thing. You don't know what's going to happen. Obviously that is what has drawn us in originally, the fact that it is so like different.
Yeah.
Because I couldn't imagine being in an office job.
Oh my god.
No, me neither.
But what I'm really excited for is we've just been assigned places for placement after Christmas.
That's
so
exciting.
we'll each be spending a day or two in different locations by ourselves. Obviously we get there by ourselves, and we put in there, and no tutors there either, so I'm quite excited to see how I will deal with that, like how I'll adapt to the like location and everything that I've learned as well.
Yeah, especially if it's a place you've never been to before, like even as a qualified dental nurse going into a new practice, it's just being a swan, isn't it? Like, just be graceful, and then you're just paddling for dear life. So how long do you do placement for?
It's so for us, if like it's like a day. So we've got two different placements. So one is at so like at a hospital, and then we have another one at a special care dental clinic.
Oh, wow.
So it's like working with people who may not necessarily visit your stereotypical surgery. So whether that be someone that suffers with autism or extreme anxiety coming to or special needs, you know. I'm quite excited for that too, to be fair. I'm not gonna lie.
Yeah, and I think it's also at an appropriate stage. It will be in January and then February, March time.
Yeah.
I don't know about you guys. I've got mine in January and then February. And I think that's enough time to, you know, build enough confidence and independence to go into a real world scenario and apply what you've learned here.
Wow, that's going to be exciting. Well, good luck when you do that. Have you got any kind of funny stories that have happened so far that you can think of?
I actually do.
Yeah, go on.
We've all got them. Your book will get bigger, but it starts now.
Basically, so this was actually one of my first ever patients in the clinic here, and she had a therapy dog with her.
Okay.
And I was basically like, when you think of a therapy dog, what do you think of? Like, just what comes to mind?
Like a black Labrador.
Yeah. A serious dog. Yeah.
And I walked downstairs, and I went to call the patient, and I said, da so and so, and this lady, she stands up, and she has this tiny little Yorkshire puppy. It was so cute. But I couldn't help but laugh, because I was with the dentist, the hygiene therapist, and I literally said to them, as we were coming downstairs, I said, bet you any money it's a black lab. And it literally was not, it was the opposite.
The total opposite.
Yeah, and it was, and bless, the dog was so sweet, and so was the lady, they were super, super nice. And she was definitely a nervous patient, bless her, but she did so well, and this was the first time bringing her dog, and she said it made the world of difference, and just to have that was super nice. But when obviously dogs can hear certain high pitched noises, so when we were when I was aspirating, and then this the hygienist therapist was bringing out the Supra for the clean, obviously the drill's whizzing and you can hear it, and the dog started to freak out, and the dog was on her lap as well.
Oh,
So
no.
we were so scared that the dog was then going to run or jump onto the stuff.
Oh my goodness.
We were literally so on edge. I had to hold the dog at one point. I was I had to hold it still, and because the dog, bless the dog and her, they were both as nervous as each other, because obviously totally new environment, because she was apparently a very new puppy, very new therapy puppy. So it was they were kind of not helping each other. They kind of were. It was kind of sweet to watch, because she was comforting the dog, but then the dog was kind of comforting her. But they were both so nervous, but it was actually very, very funny. The dog,
his dog sense when she was nervous.
and the dog kept barking and growling at me, because I had obviously all my protective gear on. I had all my so the dog was and I was like, oh my god, why are you getting angry at me? And then during towards the end, the dog actually did jump up like this, and we were like, oh my god, we're all freaking out. And thankfully the dog actually didn't jump onto anything.
Yeah, definitely.
Onto anything major, but that's my funny story so far, Loki, not gonna lie. You guys have anything, or
I don't know if ours will beat your story.
Yeah, you've topped that one.
I actually can't think of one either. Actually, do you have one?
Oh, it literally won't be Abbie's story. I mean, this isn't that funny, but I guess it's ironic that I'm working in the field of dentistry, because I was petrified of the dentist when I was little. I have nightmare stories that just traumatized me from when I was little. So I guess it's kind of funny that I'm in this field now, and I'm already kind of so comfortable, because you see these drills. I mean, when you're giving LA anesthetic, these needles, and you think you'd freak out, but I mean, it's actually okay. Yeah, even when we were doing a tooth extraction that I was watching a few weeks ago, I thought I'll get a little bit squeamish, and even the staff nurse said I'll keep an eye on you, because I had nurses faint watching an extraction. And I was like, oh no, hopefully that won't be me. But it was absolutely okay.
I had an extraction today, to be fair. This morning I had an extraction, and to be fair, I was so glad I had breakfast and a coffee, because it was my first ever extraction.
Yes.
And
You'll always remember that, I promise you. I always remember my first one. It's I didn't faint, but it's the weirdest feeling ever. Yeah.
So weird to watch, and I was oh my gosh, this is so real. And then I was it was a 2-for-1, basically, Tesco deal, because basically it was 2 teeth being extracted on the patient. So I kind of got a double whammy for my first go.
Brilliant.
And the first tooth was so small, it was literally tiny, and then the second tooth was the lower left one, so it was quite a big tooth, and I was stood there watching, and I was like, oh my gosh, deep breaths, keep calm.
I've never had a tooth extracted.
No, I've never had a tooth extracted.
I've had my two premolars extracted when I was younger.
Also.
So it was quite interesting to watch it, and that's
no, you felt it. Yeah.
I felt this before, and I mean, it looked how it felt. It's really weird to describe, but yeah.
I feel that will be me with root canal, because I haven't had endo yet, but I've had canal treatment done because of the seesaw. So for me, that goddamn seesaw. No, but
seesaw.
But yeah, Loki, I feel that's how I'll feel watching that. I feel it'd be quite cool to watch.
Yeah.
Because it's been done on me.
It was interesting to find out as well in our lecture the other day about extractions, that they actually push instead of I've also had a tooth extracted, so it was just kind of I've had 3 extracted actually. I had braces, so I had to get 3 teeth taken out in 2 different appointments, so it was a lot, but it was interesting as well to put the feeling to the site.
You know? Better watching it than having it done though, hey?
Yeah.
So So where do you girls see yourself in? Let's do the whole 5-year plan. Like, is where do you think you're each going to be in 5 years' time? Hopefully, still in dentistry.
I love dental nursing, and I love how it's so busy and like you're so prevalent in the Bay.
Yeah.
But for me personally, I would love to progress onto hygiene personally. So in 5 years, I see myself probably maybe studying for hygiene in the future.
You're going to
Somewhat.
leave us behind.
Never. This will stay for life,
Definitely.
literally. For you?
Yeah, no, for me, definitely similar. And even if I wouldn't progress onto hygiene, for example, definitely. I mean, I guess if this was a where do you see yourself in 10 years question, I'd say
Okay.
working abroad, because
Ooh.
I really like learning languages. I mean, I used to learn Spanish at A level. I might pick that up soon again. I'm fluent in Polish as well, so I mean, I'd love to apply that. I'd love to apply that to, you know, my scope like outside of the country also. I think that would be really great, especially because I mean, traveling is amazing itself.
Yeah. You've got to scratch that itch, though, haven't you?
For me as well, I'd probably like to see myself in dental hygiene. Obviously, this is a year course. It's a Cert HE for dental nursing.
Okay.
So, I'm reapplying now for university again to hopefully study as well at the Uni of Portsmouth.
Okay.
Yeah, same. Well, same for all of us.
Yeah. What is it about hygiene that you like?
For me, I like the fact that, like, I know I said at the beginning I want to bring that smile back for other people, and to be able to carry out that restorative work and just really make all the difference to a patient's smile, because for some people it might just be your, you know, once every now and again clean up, and then for some people it really can make all the difference, and it can make them feel so much more confident. I personally know I love going to the hygienist. I love coming out with like feeling like I've got a fresh new smile and I'm clean and it's just feeling refreshed.
Yeah.
For me, that's what I feel like hygiene. But I feel like, who knows, like maybe I might go back to dental nursing, like, or maybe I might do a split and do hygiene and dental nursing. Because
there are a lot of post qualifications you can do as a dental nurse. It does get you involved. I think, you know, personally, I'm in my late 40s now, but I'm involved in a lot of the appointments. Like, I have my radiography, which gets me involved in, you know, taking the x-rays for our patients. I can do fluoride application, photography, and my OH, so I get to have my own patient list as well. So, and I think because I like doing everything, for me, sticking to being, you know, a dental nurse works out well, because I get to do everything that I enjoy rather than keeping myself niche. But it'll be interesting when you're out in placement, when you get to meet other dental nurses, and you know, whether your opinion will change on where you want to go would be super interesting.
I mean, Beth especially and Jane and Sue have definitely made it clear that like there are a lot of other options in dental nursing. So like the orthodontic aspect, they definitely like push that narrative as well. Like in special care, they've had speakers come in and speak to us about, you know, home visiting dental nurses and stuff like that. So it would necessarily be just a spare of like whether we do have, like you said, like whether we do have a change of mind. Because there's just, and I think people don't really know, because for me personally, I didn't know, obviously I know dental nurses exist in orthodontic clinics, but I thought it was more to it than that personally. But a lot of people actually, I think, don't know that there are so many different roles as a dental nurse, which I feel like needs to be spoken about more, because what do you mean I never knew? Like, what do you mean I never knew that, like, special dental care, like, you know, home visits, stuff like that, and special care clinics as well, like, you know, the ones we're going to be doing work experience at. I feel like Beth and the whole team have really advocated for that side of dental nursing, which is
I
really
think you're right. I don't think it gets shouted about enough. What we do, I think it's grown, thanks to like the SBDN. I think that's great that we've pushed dental nurses out there, but just that what we can do, and I think getting as much experience as you can now in all elements of dental nursing, and finding what your passion is, what you get passionate about. For me, it was children and prevention. That's what I'm really passionate about.
Yeah.
And then also with my wellness, I'm a big ultra runner. I run lots of crazy runs, and bringing the wellness to that as well, because the mouth, you can tell a lot about someone's health generally. Keep yourself healthy, keep your mouth healthy, and implementing all that for children and going out to schools. Like, I found that was what I was quite passionate about. And you girls will, you'll find that too.
Yeah, definitely. I mean, we were also taught about, like, it's called oral systemic thinking. So your body is linked to your oral health.
Yeah, it's so
And I think
interesting.
definitely so important to inform children and teenagers, especially in school, because more of the story, like, we are in this career for informing people, informing the public, diagnosing and aiding disease, and like as hygienists and therapists and as nurses, giving, for example, post-op instructions to patients afterwards, and making sure they understand everything and they're comfortable with everything. So definitely.
Along with that, I feel like people don't appreciate how much work normal dental nurses actually do as well.
It's a lot, isn't it? Yeah.
Like, a clinic could never run without a dental nurse.
Exactly. A dental practice would never run without
And
nurses.
I've said this before to my family and friends, you never really know what goes on inside a dental clinic behind closed doors if you're just the patient. Like, when I went and did my first work experience day back at home where I live, just watching and shadowing the dental nurse.
Yeah.
Doing so much, like the amount of space they have between appointments and just the way they do it is absolute magic. And
we're always 10 minutes ahead of ourselves.
Exactly. And to just be a part of that and being able to experience that in clinic for ourselves as well, it makes it makes me feel empowered that I'm doing that much. I love that, and I feel like that definitely needs more recognition.
And I think it's finding a nice dental practice that embraces that, because I'm well aware that there aren't so great dental practices out there, but it is finding the one that embraces what you do and helps you grow, because I know not all dental practices are like that, unfortunately. So never fear if one isn't working out, that it's okay. You don't have to stay in your forever practice unless it is that amazing practice. Finding a good practice that does embrace what you want to do and encourages you to this is what you want your goal to be, and help you get there, rather than preventing you, or you feel like you've been doing the same thing for such a long time and you're not growing. Never fear moving on and finding that place that will get you where you want to go.
Yeah, definitely. And I mean, even going back to what you said about going to schools and teaching children about oral health, for example, I think it would be really good to get more teenagers, for example, who are looking at what they want to do at university or as a career in the short-term future, inform them about what dental nursing is really about, and get more people to find interest in dentistry, because it really is a great course.
I agree.
Because for me, I was quite concerned before going into dentistry about how there is just only a set thing that you can do, like quite tunnel vision. Once you go into it, you can't really get out if you don't like it. But it does just show you the options that you can do, specializing in different things. And obviously you could go into a teaching aspect, working with more people. Like, there is just a lot more things you can do that people realize.
Huge. So did that surprise you? You weren't expecting that when you started the course?
Yeah,
definitely.
I mean, we have a lecturer called Kim, and she is literally the nicest lady ever. She's so smiley.
I was
she's friendly
about
to
to say
everyone.
so smiley.
Literally,
like, today,
she's so lovely.
Yeah.
I love that.
And Kim has also, like, I feel like it's not just our lecturers, all the lecturers here that we get to learn and talk with and you know work with, they each have their own story, which is so personal, and it's so everyone is different. And like Beth was a practice manager. Kim actually did work in the Navy, if I'm correct, at one point, she's told me. And now she's back here teaching, and obviously there's just so many roles as well within a dentist clinic, like, or a surgery. And even in the NHS, like in hospitals, I know they have, you know, Maxfax, Maxafacial, like, you know, the people that specialise in that sort of thing. It's just crazy, like Ailsa said, like the tunnel vision, and then the fact that everyone here has been able to provide a light into that tunnel and just show you.
And they've all been where you are, which I think is great, because they want to share their story, and if they can share their story and share their passion, and then hopefully that does pass on to, you know, the next generation of lovely dental nurses. What final words, advice would you give if there was any potential dental nurses listening that are thinking about being a trainee? What would your advice be, knowing what you know now?
Do it 100%. Like, literally, like if you have any hesitations or reservations, throw them out the window. They're not welcome here. Literally go for it, like, because, and if you're not entirely sure, if you, like, you know, if you do have something holding you back, like you're not 100% sure, get yourself out into a work experience, into a clinic, because that will tell you the be all and end all of everything you need to know. And if you love it, gun for it 100%. Go, just jump head first, feet first.
Do it.
And just throw yourself into your work, because if you love what you do and you're passionate about it, I feel like that's all that matters.
Love that. Love that.
Yeah, go on.
I would just say lead with confidence. Like, you have to, like, have trust in yourself. You have to believe in yourself and what you're doing. Like, you are capable, and obviously you have to understand that it is a learning process. We are trainees. Like,
she's wise. She's wise.
We've just started on clinic. There's gonna be mistakes, and if there's not mistakes, then how can you learn? You know, like,
exactly.
It's like only up from here. You know, you have to lead with that confidence and, like, sit with that nervousness. Like, sit with the uncomfortability, because it will progress.
Have patience with yourself. Have patience.
Definitely.
We're all going to make mistakes, and that's how we learn. Like, you know, we learn it. I'm still learning. Every day is a school day, isn't it? Just learn from it. And I think it will take you a long way.
Yeah, I mean, like Ailsa said, like, just be comfortable being uncomfortable. You know, you have to believe in yourself, because, like she said, like, you are capable. You're learning, but, you know, you're in the course for a reason. There's a reason why you're drawn to doing dental nursing. And even if it ends up being something you're not interested in the long run, it's still such a great foundation, and it opens so many doors. So it's 100% worth it.
But as well, it's just not letting a bad experience ruin your whole time as well.
That's so important. That's a really important point.
Obviously there is going to be some bad experiences, and you can't get on with everyone, and not everyone, like, wants to get on with you, you know. And sometimes there will be, like, times where it's not going to go the way you want it to go, and that's always life, in your control.
Sadly.
And everyone's in the same boat as you as well. Like, I came in especially nervous, but the fact that everyone is, like, you know, like Asha said earlier, and Ailsa, that we're all treated the same, and it's all, there's no hierarchy. I love that. It's just, there's no pressure. Like, it seems very daunting, especially if you're going to, let's say, university, or even an apprentice, and you want to become a dental nurse. It can seem very daunting, because you have to know this, and you know you have to do that, and the whole idea of you're going into the concept where you may not know anything. If, like, you're like me, I I did like some work experience, and then everything else, it was just so new to me.
Yeah.
But everyone is in the same boat as you. That's like, if one piece of advice is have patience, be confident, be comfortable being uncomfortable. And then also like just knowing that everyone is the same.
Yeah.
Like there is no maliciousness or hierarchy, and there's no
Yeah.
pressure. There's no pressure there.
And you're always making a difference. Like,
Yeah.
you have to
Exactly.
remember that.
Absolutely, that's so true.
Doing a good
Yeah.
thing.
Yeah. Oh, girls, thank you so much. I feel like anyone that was thinking about it, it's a no-brainer, isn't it? Like, let's do it. I mean, and you're obviously, it was your expectations. It's been better than what you imagined from what I'm
100%,
feeling
yeah.
from you. So I'm really hoping that when I send this out, that we do get this influx of inspired dental nurses. It would be amazing. Thank you all for your time today. I really do appreciate it. Thank you. And those of you who are listening, if you did enjoy what you've heard today, please do give us a like and a subscribe. You'll see us on our YouTube channel, if that's okay, girls. And you'll find us on Spotify and Apple as well. So if you're not following us, please do follow us over there as well. And you'll catch us snippets of this on the SBDN social media. So we're on Instagram and Facebook. So do check us out and give us a follow over there. So girls, if you would like to give us a wave and say goodbye. Thank you.
Bye.